Hey, folks, welcome to Chapter 1 of the NASM 7th edition Personal Trainer Certification textbook. And before we get started, pretty much every chapter, I'm going to want you to do basically the same thing. Make sure you've got some study material. Read, write, recite is sort of the mantra that we do recommend. Depending on your learning style, you're going to benefit more or less from any of those elements. Reading it, of course, is important. Rewriting it can be very effective no matter what your learning style is, and then saying it out loud for you audiological learners. So just a couple of things. I don't recommend you literally read every chapter like this is a novel. Now, if you want and you have the time, it's not a bad idea to do an initial, what we call perusal of the textbook. Not everybody needs to do it, but if you have the time, go ahead. And when I say a perusal of the textbook, what I'm saying is get rid of your study material, because a perusal is not studying. It's simply a way to kind of open up your brain, I guess, open up your awareness to the material prior to spending a more in-depth study strategy analysis of the materials. So if you have the time and you have no issue just kind of going through and reading through the book, you're doing it without trying to study and learn it. That's why perusals can be a little challenging when we're dealing with, fairly academic material like you're dealing with here. But if you can do it, a quick run through, read through it, don't spend a whole lot of time. That's why it's challenging, because some of you will just go into it and actually start reading it more intensely, try to memorize. That's not what you want to do. Now, if you know you're going to struggle with that, then don't do the perusal. Just jump right into the chapters themselves. So first and foremost, if you have your textbook, and for those of you that have the online version only, you're just going to be doing this, clicking on and moving through it. Now, just keep in mind the online version that NASM provides you does not have page numbers, but that should not be that much of an issue. The benefit to the online version is you do have a little box up there where you can put in terms and concepts, and it'll take you quickly through and navigate you quickly to where the chapter and page is for those particular topics. Okay. So again, when you get into each of these chapters, like with chapter 1, first thing I want you to do is don't read through this immediately. First thing you do is go right to the end of the chapter. So I'm going to go right to page 22 in chapter 1. And the first thing I'm going to do, and we're going to recommend you do, is read the chapter summary without taking notes on the chapter summary. Just read through that. It's only a paragraph. Then read through the chapter review. So yes, I'm asking you to read, but what NASM has done is they provided you a great way to sort of initiate your walkthrough of the chapter. I think it's a great way to sort of prime you before you actually go through the chapter. So I'm going to recommend you read the summary, read the chapter review. Very easy reading. And then, in my opinion, the most important part of any of these chapters is going to be the chapter highlights. Now, if you notice, the chapter highlights are in bullet points. So stop for a second. This is going to go for chapter 1 and all the way through every chapter. You may want to write this down. The recommendation is that anytime you're going through these materials, please go ahead and stop and take some time to try and read and even memorize the bulleted points that you see. And that's why when you get to the end of the chapter highlights give you a great way to begin that process of knowing exactly what you need to know in the chapter itself. So the chapter highlights are bullet pointed. Now, okay, I'm going to give you a little tip here. The bullet pointed material that you see in the chapter highlights requires you to learn and then work with a little used technique. I've used it a long time. It's helped me a lot. Is that when I get to highlighted or bullet pointed materials, depending on how long the bullet points are, I'm going to have to crush that down into a more manageable sentence or a couple of words. Now, it's technically, you could say taking it down to its bare essential minimum of information. I'm going to show you here in chapter 1, and I'll do it through each of the chapters as we progress through. So I'm just going to go ahead and get to page 23 with me, and I'm going to read the first bullet point on the chapter highlights. So the focus on scientific principles makes NASM systems and methodologies safe and effective for any client working toward any fitness goal. Now, if you tried to, quote, memorize that verbatim, it wouldn't work. That's not an efficient way to study. What I would like to do is I'm going to use my paper and pen, and I'm simply going to write chapter 1, and I'll write highlights here, right? So then I would do the first bullet point, and all I'm looking for are words or some concept in that long sentence that I can crush down into a word or two. Your goal in any of these materials is not to memorize, for instance, these written words. You'll have to memorize certain things verbatim later on, but you just want to be able to trigger the memory of the information. You just got to know a word or two so that if you're asked a question on the exam, it will kind of trigger it and pull it up for you. So your goal is not to memorize verbatim. You want to basically look at the sort of minimum level of information that can get you by with that particular bullet point. Hope that makes sense. So the focus on scientific principles makes NASM's systems and methodologies safe and effective for any client working toward any fitness goal. How could you summarize that summary? Because that's what a bullet point is. It's a summary. The focus on scientific principles makes, NASM's systems. I don't need methodologies because it's going to sort of run on in the sentence when I think about NASM systems are safe and effective for any client. Now, that's really the heart and soul of this, even though they say the focus on scientific principles. But for me, when I look at and read this sentence, basically it's saying NASM systems and methodologies, but NASM systems are safe and effective for any client. I don't have to put working towards a fitness goal. So I would literally write that down. NASM's systems, safe. And remember, my recommendation is whenever you're notating sort of minimal levels of information, you don't have to use every single word and conjunction that's in a sentence. You just use a phraseology that is easy to look at and kind of memorize. So NASM systems, safe and effective, all clients. I don't have to write for all clients. I just write safe, effective, all clients. Move on to the next one. Keep in mind, you've done two things at this point. You've read the material, which you ain't going to memorize things by reading because reading is not studying. I've got to write things down. But what I did do is I looked at it, I read it, it's in my brain a little bit, and then I thought about it and rewrote it. That's the kicker. And that's what I want you to do, especially when you're initiating these chapters. So, read the summary, read the chapter review. Significantly less time to do that than to read through the entire chapter. It's not necessary. And then go through the chapter highlights, looking at each of these bulleted points and try and, what I call it, crushing it down to a couple of words or a concept that's easy to say out loud and then write down. It's a lot easier to memorize. By the way, all those notes you're taking, it's probably a good idea to keep them because you can go through. Remember, you're note-taking. What you're doing here when you're reading and reciting it and then doing it again and again, you're really pushing that into your short and midterm memory, which can be very valuable if you've got time to go back and review the materials again. Exposure to the material is key. The more you expose your brain to the material, the easier it is, or I should say, the more effective it is from a memorization standpoint. So that's basically at page 23, 24. Now, if I go back to the very beginning, I'm going to give you some more hints, and I'm doing this on chapter 1, so you get the idea as you click into the subsequent chapter level videos. Another thing to keep in mind is that NASM gave you a very effective way to memorize key terms and concepts. So remember, I've got one sheet. I went to the end, went there, looked at the chapter review. I did those bullet points, and now what I'm going to do, by the way, use this, but you should also be using the Quizlet because that is a great way to help you memorize. You must memorize information and material. That is one of the key study strategies that we highly recommend that you get into and start thinking about. And one of the ways you do that is by, I'm on page 2, I'm on chapter 1, and NASM has given you, this is why you don't have to read through every single page. NASM has given you terms that are important terms, and they also put them in blue in the actual copy itself, in the actual text. Obesity, kinesiology, evidence-based practice. Now, when I see a word like obesity, I'm going to write that down because it gives me a very clear, straight definition, obesity, and do the same thing that I just recommended you do with your chapter review bulleted points. Crush this definition down. One of the best ways to learn information is to access it in a way, push it into your brain in a way that works for your brain. The editors, when they wrote this definition, gave you a very clear, strict definition, but my brain don't work like that. It doesn't absorb it in a sentence of a complex disease involving an excessive amount of body fat classified by, there it is. Obesity. I would write down obesity equals BMI, body mass index, greater than 30, because that's the way you'll see the question on the exam. I hope that makes sense. Your goal is not to learn everything you can from this textbook. Your goal, at least that's the assumption that we are making, is to pass the NASM exam, which means there's information in here probably not going to see on the exam. A lot of information you will see, and you need to see it and understand it in a form that they're going to ask it to you in the questions, okay? So I'm, again, got my trusty pad and pen, and I'm going to start going through. First thing I do is I look at my side panels for terms, try to crush those terms down into words or concepts that make the most sense, and I just move on. And you'll notice that on every page in this textbook has a bunch of side panel terms. I know what you're saying. There's 1, 2, 3, 4, 5, 6, 7, 8. My God, 9 terms. Yeah, there's a lot of terms you need to know and memorize. The point is that when you look at the terms, some of them you'll probably know or they will make sense. Your job is to read them and rewrite them, but rewrite them in a way that's sort of bare minimum from what they wrote so that you can remember it. Again, it's hard for me to remember musculoskeletal system, the combined, I'm on page 4, combined interworking system of all muscles and bones in the body. Combined interworking system of all muscles and bones in the body. So I guess musculoskeletal system is your muscles and your bones working together. That's the way I would do it. That's the way I would think about it. And you're going to do the same thing for all of these. Now, if I move on, and by the way, you'll notice there's what they call a stretch your knowledge box. It doesn't hurt to read it, but you're not going to see this information for the most part on the exam. So if you want to move past that, go for it. Again, listen to what I'm asking you to do. I'm not asking you to read all of this information. What I've said was go to the back, look at your terminology, learn your terms, and I'll let you know if any of the figures or the tables or the charts are important to know. Okay, so page 4, you've got some information terms you need to know here. Figure 1-2 is the OPT model. Basically, what they're giving you is a very simple visual of the what we call the phases and the levels. And so you could spend some time right here, kind of drawing that out and memorizing that. Wouldn't hurt, but it's not necessary at this point. Go to page 5 and look what we got. Bullet points. Bullet points. What did I say about bullet points? Immediately stop. I would immediately stop and go, okay, let me write this down. An integrated approach to exercise represents the inclusion of the following forms of training. I'm going to write those down: flexibility, mobility. And you're saying to yourself, I already know this, or you don't know it, but write them down. And that's part of your note taking. And then you move on. Global state of health. Well, I've got 1, 2, 3, 4 terms that I need to know. And that's what you're going to spend your time with. Please don't read the text unless you like reading the text. It's not an efficient way to study. You'll notice that they're giving you a lot of material, written material, and then they're giving you this concept right here, socioeconomic status. So the recommendation is learn some of the terms that you would be tested on, and that's really where you would spend the majority of your time. Next page, this is chapter 1. There is a good little chart here, figure 1.3, spectrum of health. There's nothing wrong with at least looking at it, because not every figure and not every table and chart is necessary to memorize, but it's not bad information to know. And it is kind of interesting to spend some time, for instance, on figure 1.4, understanding what the leading causes of death are. What is the leading cause of death? Non-communicable disease? Well, it's ischemic heart disease. Well, that's kind of interesting. Stroke is second. Those are interesting concepts. Are they going to be on the exam? More than likely not. There are boxes here such as training tips. Remember to stretch your knowledge. Once again, I only recommend you read through these. If you're comfortable reading, you're not going to necessarily memorize this information. They generally, not always, but generally will not ask you questions from the stretch your knowledge box. Some students have said that, yes, they do remember seeing a question here, a question there. It's about efficiency. You need to move through these materials, learn the information that you need to, that's critically important to learn, and move on. And you can always come back and review if you need to. There is a training tip box up here. Health is a dynamic, ever-changing process. Again, nothing wrong with the information, but it's not generally going to be necessary to learn any of that. NASM will not, figure 1.5, they're not going to ask you questions that are generally precision. The numbers have precise numbers, or excuse me, numbers precision related to a question. So they're not going to ask you, for instance, preventable causes of death, drug abuse is how many deaths per year. They're not going to ask you a question like that. They're not interested in sort of arcane information from a personal training perspective. We move on to page 8. You have 1, 2 pieces of information you need to know: risk factor, cholesterol. Now, when you look at page 9, they'll give you a box that says critical. I do recommend you read this. With so many in the greater population dealing with one or more chronic health conditions, it is essential for fitness professionals to be familiar with the most common conditions. Now, that's important information you should know. They may actually ask you a question, again, depends on the chapter, based on one of these critical information boxes. Now, you're probably reading through this and going, yeah, but look at all this written material. Keep in mind, not everything you read in here has relevance on the exam. It's good information, but do you want to pass the exam and do it relatively quickly, or do you want to learn everything about the textbook? And that's only going to frustrate you because you simply can't memorize everything you're seeing in here. So again, figure 1.6, interesting information, which will probably change. Look, after these books go to print, a lot of these statistics are probably out of date, but again, interesting information. Now, again, there's a critical box on page 10. Good idea to read that. When you get to table 1.1, you have what are known as the body mass index classification. I don't say this often, but this is one of those tables where stop, pull this out, and make sure you know these numbers. 18.5, right? 25, 30, 35, 40. You should know these because you will more than likely be asked a question. And, you know, the reality is that you can memorize this, but you need to do it over and over and over. It's not a lot of information per se, okay, but you do need to rewrite. And the way you do this with any of these tables is go ahead and take a sheet of paper and literally rewrite the table. And I've done this 1,000 times if I've done it once. BMI of less than, and I literally rewrite the table. In this case, it's only 3 columns. And so you only have 3, 2, 4, 6, 18 pieces of information. For the most part, they're going to make sense to you if you just see it on a test. obesity classification of obesity 3 is indicative of the following. Disease risk factor increased, very high, or extremely high. The answer is extremely high. Obviously, the lower, less than 18.5, greater than or equal to 40. Those are easy to memorize. Your key number to memorize in this case is 30. When a person has a BMI of 30 or greater, it's obesity. It's just that when you hit 35, it becomes obesity level 2, so to speak, or obesity 2, and then over 40 is obesity 3. So that's an important one to remember. Memorize on the side panel, page 11. Stroke for sure. Remember again, a sudden lack of blood supply to the brain caused by either a blockage in an artery or ruptured blood vessel. A stroke, lack of blood to the brain. And there's two ways it happens. You can have a blockage in one of the arteries in the brain. Sometimes it's an arterial. Even capillary beds can be sort of embedded with plaque, but it's generally the artery or the arterial that leads to an area of the brain. Or you can have a blood vessel that actually just bursts. Okay, and so those are the two types of stroke. Ischemic strokes are the ones that we normally or see associated with it, but they don't even tell you. They don't even give you that information on the side panel. Now, they do say ischemic heart disease characterized by narrowing coronary arteries, but you see, you're already getting into the weeds. That's what you need to memorize. Okay. Next page, arterial sclerosis. By the way, they have a physical activity, bodily movement. I'm not sure you need to memorize that. If you don't know what physical activity is, then you need to memorize it. But because they're going to make a distinction between exercise and physical activity, right? So that's what that helpful hint box is. Now, again, I'm not telling you not to read these. Again, it's interesting information. The question is will it be on the exam? And I can't tell you the exact questions that'll be on the exam, but for the most part, you're not going to see, specific targeted questions about this particular helpful hint box. It doesn't mean you shouldn't read it because it's only a paragraph. There's nothing wrong with reading it, and it's actually interesting information. But you do want to know and memorize systolic blood pressure, diastolic blood pressure. The stretch your knowledge box on page 12 and 13. You should read those. They should be, shall I say, common knowledge for sure. As a trainer, you should know information related to these basic health issues, such as blood pressure or high blood pressure. And by the way, they do give you in the stretch your knowledge box. That's why this one is very important. You need to memorize what is normal or healthy blood pressure. It's less than 120, less than 80. Okay. Know those, write those down, and know those by heart. You got to know what a blood pressure of 125 over 79 means. You got to know that. And that's what that information is going to tell you. So stretch your knowledge, good, bad cholesterol. Yes, that's important information to know. I'm on page 14. Once again, look at the diabetes, glucose, insulin resistance, all very important concepts that you need to know. Memorize them. If you already know them, then don't clog your note-taking pad with it. It's not necessary to read through this entire paragraph. Is it interesting information? Absolutely. If you're trying to get through the material and squeeze your time into a time frame where you want to take this test and get it done in 3 weeks or a month or 2 months, whatever the case is, then you have to balance this out. Do you read the entire thing? And the answer is no, it's not necessary. My recommendation is for sure, memorize the terms. If you're unsure of the terms, then you can reference back into the material that they've given you. Okay. Again, this is a run through of the chapter. You can spend more time or less time as we're going through this, depending on what your particular time frame is, obviously. So sprains, plantar fasciitis, patella tendonitis. All of these basic dysfunctions are important, very important to know. Shoulder impingement syndrome, right? So now chapter 1 moves into the healthcare continuum. Going to be the same thing. You'll notice on pages 18 and 19, you don't have any sidebar terms to memorize. But look what you got on page 18. You got figure 1-8. Now, do not memorize figure 1-8 because there's a lot of information, ironically enough, in this small little heading right here. But what I would recommend, because table figure 1-8 is actually explained a little bit here in the allied health professionals. There's 1, 2, 3, 4, 5. Not a bad idea to understand roughly what each of these allied health professionals do. So you've got physical therapists, athletic trainers, ATs, chiropractors, registered dietitians, licensed massage therapists. For the most part, those would be the individuals that you would, as a personal trainer, maybe, perhaps, in some way, shape, or form, be speaking to and engaging with, depending on your clientele. Okay. Now, again, not much more on page 19 that you need to go through. Scope of practice, code of conduct. They will for sure ask you some questions. My recommendation is, yeah, go ahead and read those two paragraphs. Not necessary. It's not like you're going to take a bunch of notes on here, but it's scope of practice and professional conduct. This is not a bad idea to read through it. Do not spend a lot of time trying to memorize this, because they're not going to ask you specific questions. And by the way, if they do ask you a very specific question about code of conduct, it would be, let me use the word, common sense. At least that's what I would recommend. I would not spend a whole lot of time trying to memorize all of that information. Legal and ethical. Okay. Do I have to tell you to obey all local, state, federal, provincial laws, regulations, and professional rules? I hope not. Accept complete responsibility for actions. Again, I hope I don't have to explain that to you. If you want to write that down to memorize it because you don't know that, absolutely. In general, most of what we have here on page 22 is a done deal. Okay, it's a done deal because you should. This is what we would call common sense, and I hope I'm not making an assumption about your personal understanding of basic business practices. But read it. If you don't know it, absolutely rewrite it and review it so you do memorize it. Now, again, that takes you to the end of chapter 1. Keep in mind that once you make it through chapter 1, you've got your notes. I try to keep an individual pad like I have here for each chapter. Yes, you are going to go through, more than likely, a lot of paper. If you are taking, if you're using the online version of the textbook, do yourself a big favor. Don't type this stuff out on the notes section. It just does not work the same way. At least that's what I found. If that's what works for you, absolutely. But my recommendation is just get back to basics. Pen, pencil, markers, and then notepads. So that is the conclusion of chapter 1. Looking forward to seeing you in chapter 2.